Hello, this is the second part of my presentation, and we are going to start by looking at how families manage sibling conflict. So according to the study, Parental Beliefs About Managing Sibling Conflict, parents choose forms of sibling conflict management strategies based on their beliefs. So this means their opinions or what they generally think about that strategy, or also if they think it is moral or ethical to use with their children. And then they also choose management strategies based on how well they would be able to perform that strategy. The study split up conflict management strategies into three categories: child-centered, parental control, and then non-intervention. Of these three categories, it was found that parents used the non-intervention strategy more often, but they did not think it was the most effective or that they had confidence in performing it. However, it was used 3 times as often as the other strategies. The child-centered conflict management strategies were more likely to be used with younger sibling pairs, and the passive non-intervention strategy was more likely to be used with older sibling pairs. This may explain why sibling abuse starts happening at around 6 to 10 years of age. The non-intervention and control conflict management methods were the most popular in the study. However, they are not supported by the early childhood development field. So how can parents learn, use, and feel more confident in child-centered conflict management methods? One way they can feel more confident in using child-centered methods is by training through counseling. And this is a 3-step process. The first step is report building, which during this step, most parents will enter counseling with resentment and feeling that their authority is being challenged, especially if they are being forced into this counseling. This is why it is important for the counselor to approach the family with empathy. The counselor must work with not only parents, but also the perpetrator and the victim. So the whole family should be worked with, but also the individuals based on their need. The second step is assessing the family environment, and this starts by focusing on the family's strengths. During this step, identifying situations that demonstrate positive behavior is important, and then coming up with the rewards to reinforce that positive behavior is also important. The third step involves implementing specific interventions, and one therapeutic strategy is the SAFE strategy, which involves stopping aggressive actions immediately, assessing what is happening, finding out what can help to avoid violent interactions, and then evaluating the solutions in the situation in a few days or weeks to see if it is working or if they need to try something new. Extra counseling interventions that need to be kept in mind. When it comes to male perpetrators, their masculinity and what it means to be a man needs to be evaluated, especially if the sibling pair is a male and a female. And then when it comes to female perpetrators, gender stereotypes about aggression need to be addressed because the sibling abuse may be happening because females are not considered violent or aggressive. And then when it comes to a dysfunctional family, additional measures for individual treatment and relocation of the children may need to take place before the sibling abuse can be solved or addressed. Other community support involves parents as teachers, or places like the Parenting Life Skills Center here in Springfield, Missouri, or Head Start, which has many options for supporting families and young children. In conclusion, sibling abuse is more common than we think. We can solve sibling abuse through training and equipping parents with different kinds of research-based conflict management strategies with their children. And then one way parents can become confident in practicing certain conflict management strategies is through community support, such as family counseling, parents as teachers, the Parenting Life Skills Center, or Head Start. And then these are my works cited. Thank you.